Hi, my name is Dedee Culley. I'm an RN, cannabis nurse, and the owner of Two Leaf Nurses, where we focus on education, advocacy, and collaboration for Missouri medical marijuana patients. We also work with businesses, healthcare professionals, and the community. Now, I'm not a physician. I don't diagnose, treat, or make any claims as to what cannabis can do. I simply am here to provide education so that you, as a patient consumer, have the final say regarding your healthcare decisions along with your provider. I'm honored that Dr. Luke and his team have asked me to provide some education as we prepare to launch and make available medical marijuana in the coming months here in Missouri. People often ask me why in the world I would start a cannabis consulting business. And it's actually quite simple. Over my last 20 years as a nurse, I've seen firsthand the improvements that patients using this plant, even though in most states during this time it was illegal. And the more I learned about it, the more it made sense. And I realized that with state by state legalization, there are many patients out here that need help, and I can provide that. Now, you notice that I may say cannabis or marijuana. Some people are more comfortable with one or the other, and that's okay. For general purposes, they're interchangeable, and you'll hear me say either one or both at any given time. Today, what I want to do is give you some background and a little bit of biology before we talk too much about the plant, the legalization, and things that it can or may not be able to do for a person. So let's get started. Our bodies are made up of several systems. You can probably name at least a few of them yourselves. And each system has a function, and those systems are dependent on each other. Now, what many of us didn't know is that we also have something that's called the endocannabinoid system. Now, before you panic and think, wait a minute, I didn't learn that in biology, or was I sleeping, or did I fail that test, or did I forget to show up for that class? You're not alone. It's not taught yet in mainstream education. It's not taught in a lot of the medical schools or the nursing schools. There's a few pharmacy schools that will do that, but it is a real thing. And here's what you need to know about it. The endocannabinoid system, or the ECS as we affectionately call it, is responsible for keeping our body systems in balance with each other. It's called homeostasis. When our body is in balance and all the systems are in good shape, the ECS is quiet. It's shut off, so to speak. But when something happens that throws our body out of balance, the ECS turns on. The way I think about it, it works kind of like a walkie-talkie or a 911 operator. They're on the phone, they're waiting for something to happen because they know it's going to, right? And as soon as there is a problem, then it activates. When it activates, it produces and releases and sends straight to the source what we call endocannabinoids. They're cannabinoids that our bodies make. The two that they make is anandamide and 2-AG. These are sent straight to the source. Once the problem is resolved, the ECS then produces and releases a couple of enzymes called FAAH and MAGL to inactivate the anandamide and the 2-AG. Once they're inactivated, the ECS shuts back off and it goes back into that listening mode. Here's an example, okay? Because I think real life is probably a lot more applicable than just a lecture, right? So we're all at home right now. We're walking around our house, everything's fine, our bodies are in balance, we're minding our own business, right? And all of a sudden, your toe comes in direct contact with the corner of the bed. You guys know what I'm talking about, right? Or maybe it's a chair or a table leg. We've all done it, right? Or we have our funny bone head and it hurts really bad. And there's not anything we can do about it, right? We're just frozen for a moment in just shock and pain. Some of us scream, some of us yell, some of us grit our teeth. All of those are normal, right? What's happened is our body is out of balance. Our toe is throbbing. It's probably red. You're in that extreme pain. You guys know what I'm talking about. But here's what happens. As soon as that toe came in contact with the table, the chair, the bed, whatever, That pain prompted your endocannabinoid system to activate. It produced anandamide to stop the pain and 2-AG to take care of the redness and the inflammation. Once everything was deemed okay, you were breathing, you realized, I'm going to be fine. Okay? That pain, you realized that when the pain subsided, as soon as that was all back in line, the endocannabinoid system produced and released those two enzymes in order to shut the endocannabinoid system back off. Crisis resolved, and your body was back in balance. Why is this important? Okay. Endocannabinoids are much like the cannabinoids that are found in marijuana. Anandamide is very similar in structure and function to THC. And the 2-AG that our bodies produce is very similar in structure and function to that of CBD. We're very familiar with hearing those two terms, right, THC and CBD, when it comes to cannabis. So when our bodies are overstressed, they're compromised or damaged, our ECS isn't able to work as it's designed. And that is where medical marijuana or cannabis can help. It can provide your body with what it is used to making on its own, but because it's not able to, and this is a plant, and the plant is natural, it's bioavailable, our body recognizes it and it immediately uses it. It doesn't have to figure it out, break it down, or anything else. And we also don't see a lot of the side effects or the damages that can be caused from overuse of some of the other synthetic substances. And it's simple to use. Cannabis is not, however, a magic potion. It's not a snake oil. It's not a cure-all. It's not any of those things. And if you use it because you need it, you're not a pothead, you're not a stoner, you're not any of those things that we have been brought up to think. It is a plant, very simple. And it is a medicine, and it needs to be treated as such. And if you need it, you also need somebody who can help you determine what and how to use it to be safe and successful. That's where I come in as a nurse focusing on cannabis. Every patient deserves a nurse, and I'm here for you. You can contact Command Family Medicine. They can contact me, or you can contact me directly. So until next time, take care and be safe.